Good job. Just with you guys. All right. Thank you all very much for taking the time to be here. I know this issue of the swine flu is top and center in people's minds, so we thought it appropriate, rather than just being tracked down today to answer any questions, we would have the opportunity to bring our experts together and discuss where we are in relationship to this issue as it relates to the concerns that have been expressed, not just across the state of California, but across this nation and now increasingly around the rest of the globe. There are no reported incidents of swine flu in San Francisco or, to our knowledge, the San Francisco Bay Area. So I want to begin there because I'm sure that's the first question you have on your mind. Second, I think we all should take a deep breath and make the case that this is not a pandemic at this point by any stretch of the imagination, that the swine flu, to the extent that the 40-ish cases, and again you're going to hear that number increase naturally, it's expected, has not produced any strain of a virus that has led or is most likely to lead to a death, that it's treatable. And so people should know that. We're not shutting down schools. We're not isolating people in the city and county of San Francisco. We don't anticipate that will be necessary. And everybody should go about their day-to-day lives using the same common sense we ask you to use each and every year around this time of the year when we have the basic flu, which now doesn't look so ominous, does it? Many of you, I'm sure, in this room have gotten the flu. And so we encourage you to wash your hands and consider when you're coughing not to use your, to use your sleeve, to get, to the extent you can, to think about your hygiene generally, and just go about your day-to-day lives. In fact, months ago, if I did none of you would have shown up, but we rolled this out, this Infect Me Not campaign in San Francisco. Little did we know how prescient it would be. This was something we do on an annual basis. It relates to flu season, and it talks about how you can protect yourselves with healthy habits. And one of them was avoid touching wild animals, self-evident. Wash your hands regularly. Clean and disinfect. When you cough and sneeze into your sleeve. I want to remind you all, because I've seen one of you cough already. That's important. Handle and prepare food safely, and this is something we're communicating. Vaccinations for those that feel they need it. And again, not everyone needs it. Healthier people or young and old may have different responsibility. Talk to the doctor about that. Don't share personal items, shavers and the like. Again, common sense here. And finally, stay home when you're sick. Don't infect other people. If you're coughing, you're sneezing, you're not feeling well, no reason to go to school, no reason to go to work and infect everybody else, no reason to jump on a bus and infect everybody else on the bus. So again, this campaign, Infect Me Not, relates to germs, relates to the general issue of health, and it should be underscored today. So that's a campaign we already have out there. I will not, because I shouldn't, get into the details that Dr. Katz and his team will get into in terms of the technical aspects of the swine flu vis-a-vis our approach and contrasting it with, for example, the avian flu and the difference between birds and pigs and issues between this virus compared to the virus that is manifested in more deaths in Mexico. They will talk about that. But I want you to know that a good resource, and there's a reason Nancy Alfaro is here, is 311. And it's a nice reason we have 311, that we don't need everyone calling 911 to get information and backing up our emergency lines. They now have 311, which is in essence a 411 information system that's 24/7 for people to get information about what they can do and what this means. In addition, we have Vicki Hennessy here from our Department of Emergency Management to the extent that we would need to take things to the next level. And again, that's always a prospect. But let's not overstate things, that we're prepared to do that. And then Dr. Katz will introduce you to two of his leading experts that know a lot about these issues, because we are a gateway city to Asia and Pacific. We're a city that has its own labs and can test for these types of virulent strains. We're a gateway as it relates to running an international airport, and we have strategies and procedures and protocols that are well in place and have been for years at the airport, and can talk to you about what we've done already, including as of last Friday, already reaching out to all of our physicians groups and doctors and letting them know that we're here as a resource, and letting us know if there's questions that we're here to help support and advise and direct. That had already been done just a few days ago. So again, message is no one in San Francisco, to our knowledge, yet been infected. The likelihood is that eventually someone will come forward. No question, you're going to see a lot more cases. That's the nature of any kind of flu come out in the United States, and that should not be cause of mass hysteria or alarm. That there's ample supplies of Tamiflu in San Francisco and in this region, now made more robust because of what President Obama has advanced, and that was really the cause that they advanced the other day, though I think, we joked maybe they should have announced they were going to distribute more Tamiflu as opposed to a declaration of emergency, which was really, as I think the Homeland Security Director, Janet Napolitano, said, its best phrase is a declaration of emergency preparation. And I think that would have calmed nerves, and I think here today, I think you'll hear from Dr. Katz next that people should, by no stretch of the imagination, not feel anything but calm and feel at ease with the respectful obligation to always be prepared if things change. And in the world of flus and influenza and issues of pandemic, we're always prepared because things can change rapidly, and that's why we're here today. So with that, Dr. Katz will talk more specifically.
Thank you, Mr. Mayor. I don't want any of you or your viewers to be worried about the swine flu, because that's my job. I spent the weekend worried about it. I spent the weekend making sure that we were doing everything necessary, and that's a responsibility that people can have confidence in, that their mayor, their health department are all making sure that if there is anything further that needs to be done, we will do it. Why are people worried about pandemic flu? The concern is that were there to be a change in influenza, and if that change in the virus were such that it were either to become more virulent, which is a fancy medical word for meaning more likely to harm people, more likely to cause them to be in the hospital or to die, and condition two, and people had no immunity to it, because it was a completely new strain. That's what would cause a pandemic. Something very virulent and something that people had no prior exposure to. So whenever we talk about an influenza that is from birds or from pigs, that's what raises the concern, right? Because that means that it's different than what we're used to. It's different than the annual human influenza that we prepare for by vaccinating people and by reminding them of the important sanitary steps that the mayor explained so well. So when we hear about pig flu, then I have to worry. I have to say, well, hey, that could mean that that virus is something that almost none of us have exposure to, therefore we don't have immunity to it, therefore it could cause a lot of harm. What is comforting about the experience in the country so far is that it is not virulent. That is, it has not been associated with serious disease, and it does respond to a treatment that we have available, Tamiflu, and we have that in adequate amounts so that were this to become a more serious epidemic, we could dispense that rapidly. I want to ask Dr. Ferniak, who leads our response from the department and who's been coordinating it, to talk about some of the specifics in terms of how many cases in the U.S., how many cases in Mexico, what potential differences there are between Mexico and the United States in terms of those cases, and what further steps we might take were this to become more serious.
Good morning. Thank you, Dr. Katz and Mr. Mayor. So just to give you a situation update on where we are, so as of this morning, the CDC was reporting a total of 7 cases in California. All of those have been in San Diego and Imperial County. And those cases have been that's a stable case number over the last 2 days. There was a big jump in total cases from 20 to 40 today, and that really had to do with a large cluster of cases that's been identified in New York City. There have been a total of 28 cases in New York City. There are additional 2 cases in Kansas, 1 case in Ohio, and a couple cases in Texas. Now, the situation in Mexico is a little bit different. The situation there has been going on longer. And we honestly don't have as much information about that situation as we'd like. The CDC and WHO are convening daily with the Mexican health authorities to try to get a better handle on what's happening in Mexico, and they pass that information on to us on a daily basis. In fact, one of my staff is on a conference call with CDC right now to get those updates. But the situation there is very different than what we're seeing in the United States, and to date we aren't seeing the number of cases or the disease severity that we're seeing reportedly from Mexico. So I think everyone really needs to remember that again, we only have 7 confirmed cases in California at this point. As Dr. Katz and both the mayors suggested, we probably will see more cases in the coming days. One of the things that my group did on behalf of the health department on Friday was send out a health alert to all San Francisco clinicians, asking them to test additional cases of flu-like symptoms that show up in emergency departments and are currently hospitalized. And we did receive a number of specimens in our lab this morning, and we will be testing those later today. In addition, because some of the new cases that have been identified in the U.S. over the weekend were in people who recently traveled to Mexico, we've also asked clinicians starting today to begin screening everyone that they're seeing with influenza-like symptoms for recent travel to Mexico or another area where there are cases. And we'll be prioritizing testing of those patients just to make sure that we're sort of ahead of the cases that we potentially have in San Francisco. So the other things that I wanted to address are that the most important thing at this point is communication. And from my end, we're staying in touch very closely with the CDC, as I mentioned, also our state colleagues. There's a conference call this afternoon, and there were conference calls all weekend long with our state colleagues, as well as our regional colleagues, to make sure that we're all clear on what everyone else is doing and what the situation is in the other counties in the Bay Area. We are going to be working closely through Vicki Hennessy's group and DEM, as well as our city partners, to make sure that we're keeping everyone informed of the situation and that we have information out there as quickly as we can get it to everyone. And we're very thankful for 311 because we're going to be utilizing that for the public to call. The other thing I want to really point out is that, again, we're talking about a strain of influenza that started in swine or pigs, but we're talking about as Dr. Katz pointed out, we're talking about a strain that is at this point clinically mild, very similar to what we saw this year for seasonal influenza, and we're also talking about a strain that's sensitive to the antiviral medications that we have. And as has been mentioned, we have plenty of those antiviral medications. There are lots in the pharmacies. We also have a stockpile in San Francisco. There's a stockpile at the state level that will be made available to us anytime that we want it. And the CDC and the feds are also going to be releasing their stockpile. So it's very heartening that there is a treatment for this particular strain, and that there are plenty of medications around. I think all of you, as the mayor started out with, this is really another opportunity to remind people that the number one thing to do is to stay home if you're sick, and to wash your hands frequently, and to cover your coughs. Those are the messages that we want to make sure that everyone continues to hear, continues to think about, and continues to implement in their everyday life. And Eileen Shields, our public information officer, I think was handing out some materials. She has some of our germs brochures. We have those in Spanish, English, and Chinese. And we also have a flu home care guide. So this is a home care guide that we prepared so that people who have sick members in their home can think about how to care for them safely. And this Ms. Shields has copies of this in English, and we also have this in a PDF file on our website in both English and Spanish. We've been working on getting this translated into Chinese also, and that should be up on our website in the next couple days as well. Now, our website for everyone, because on that website you can find links to all of our materials. In addition, you can find our health alerts, and it also has links to the most important CDC and WHO and California Department of Public Health websites. And that address is sfcdcp.org. So San Francisco Communicable Disease Control and Prevention.org. There also should be a link up within the next hour from our SFDPH home webpage as well. All right, thank you very much. I'm going to turn it back over to Dr. Katz. Dr. Susan Fernyak, F as in Frank, E-R-N-Y-A-K. I'm the Director of Communicable Disease Control and Prevention at the San Francisco Department of Public Health.
I'd like to ask Dr. Sue Carlisle, who is the Dean of Physicians at San Francisco General Hospital, to talk about how the hospital is preparing, because one of the things that gives me confidence is knowing that were we to have a serious epidemic, we have a world-class hospital staffed by University of California, San Francisco physicians who are prepared to take care of people were they to become seriously ill.
Good afternoon. I also want to add to what has already been said, that we do not at this point feel that we have a serious pandemic here. However, because of our experiences with other influenzas, we are always at San Francisco General prepared to take care of a pandemic. We have enough medical supplies in storage that we can double the capacity of our hospital in a minute, 5 minutes maybe. We also have put out an alert throughout the hospital that we will test anyone that has any flu symptoms that come into the hospital, into the emergency room, or into any of our clinics, so that we can very early identify anyone who is in need of serious treatment. But as has already been said, this appears to be a very, very treatable illness, and one that is in most healthy patients not very serious. So I would add to what has already been said, and that is, if you're ill, stay home. Unless you're seriously ill, and then you need to come in so that we can care for you. And we are always ready to do that.
Great. So, and they're here for questions, and happy now to answer any questions.
Dr. Katz, two questions. Is there a swine flu vaccine, and if so, can you take it if you've already had a flu shot?
There is not currently. One of the challenges of influenza is how rapidly it changes. And the technology which the federal government is working on is really 100-year-old technology. Vaccine is developed in chicken eggs. And it takes several months to develop a sufficient quantity. They are working on recombinant techniques, but right now there is no vaccine to take.
Given what's happened in New York City with this trip of school kids to Mexico, is the health department canvassing any schools in San Francisco to see if there were school trips to Mexico?
Right. We know because of where we are. I mean, we know that there are people coming back and forth between the U.S. and Mexico, multiple flights each day. So, I mean, there's no question that there is back and forth, and that would involve some school children. Right now, what our focus on is, are people seriously ill? As you might imagine, because of the mild nature of swine flu, there will be cases that will be missed because someone will think, oh, my child has that flu again, or they have that respiratory infection that they just had. But we are working closely with the school district. They're part of the city's emergency center, and if they're aware of illness, but we will not, and we do not advise social isolating children just because they recently came from Mexico. The federal government has has not put any current restrictions on going to Mexico or coming back from Mexico. So, we want to just keep track if people become ill.
But we're aware of a lot of kids returning from spring break.
Absolutely.
We're down there as well, and so we're very cognizant of
So
that.
are you though making calls to the schools, or are you doing outreach to school nurses, or?
Right, yes. So the schools have been alerted about swine flu and about looking for symptoms. Again, what we don't want to do is, on the basis of a small number of people not being sick here with a mild illness, you don't want children to feel like, oh my goodness, I have something so horrible that I, have to, be isolated from my friends even though I feel fine. Right, so it has to be focused not on, oh, you were recently in Mexico. It has to be focused on, oh, you have a fever and you're coughing and you've recently been on Mexico. And frankly, our main message is, if you have a fever and you're coughing, you shouldn't be in school whether you've been in Mexico a day ago or you've never been in Mexico in your whole life. So we want to make sure that the message, is appropriate and, both safe but not stigmatizing.
Communities have been sending healthcare professionals out to people's homes to check up on cases because you want people to stay at home if they're sick, but you also want to track this and know. Is there any talk of doing that in San Francisco, of going out and doing that kind of?
I mean, what Dr. Carlisle said is certainly true, in that the safest place for people with a mild influenza, both for them and for others, is at home. Right. We're not particularly interested that, people who are sniffing a little bit and are worried, well, gee, maybe, this is the swine flu that's causing my sniffles. We don't want them, on our public transportation, right, going to their doctor for a nasal swab that doesn't, that isn't going to change their treatment. At the current time, we just don't have the caseload or the severity to suggest that we should be out there. But certainly that's part of the emergency planning, is that if we suddenly had 3 sick kids at a school, we're in a position where we'd be able to send public health nurses out that day to do the swabs.
Part of my question, and that is, how easily does this transfer from person to person? For instance, you just mentioned public transit. If you're on a crowded bus, maybe you're on a crowded BART train.
Right, so influenza is, no question, a contagious disease. Although different influenzas have different levels of transmission. So, for example, we were very concerned at one time about bird flu, as the mayor alluded to. Why have we stopped being concerned? Because it turned out that bird flu really was not easily transmissible between humans. So the humans who got bird flu were people working with birds. But then it wasn't anything about them. It was just the virus itself did not appear to be easy to transmit, and it just burnt out. Based on at least the early experience in this country, it would look like swine flu is going to be the same way. The one problem is, as Dr. Ferniak mentioned, the lack of clarity about what's going on in Mexico. Because there it's operating like a disease that's easily transmissible. But that just has not been the experience so far in this country. And so it remains to be seen. But yes, influenza is transmitted through respiratory droplet. That's the mean of transmission. So if someone sneezes next to you and you see that little explosion and they haven't gone like that, right, then it is in the air and you're breathing those viral particles. And there is an ability, although it's a little less efficient, that if someone, wipes their nose with their hand and then is on the BART handrail, and that's where our, public transportation sign came from, the infect me not, showing the 2 handrails, that then if your hand is on that handrail next, right, and then you're wiping your nose. But that is decidedly less efficient than someone coughing at you, sneezing at you. And so number one is to, if you don't have a Kleenex, to block your sneeze.
But Mitch was saying earlier in our department head meeting, we had a chance to talk to all our department heads about this, including members of the school board, Hydra Mendoza notably. So again, we've sort of reached out to the city family. The birds are very genetically dissimilar to humans, pigs more similar than birds are, and so there's a greater likelihood, again, of that transmission compared to birds. But again, genetically, we're hardly equivalent. Would you agree? Good. I'm just looking at anyone for concurrence on that basis.
Dr. Katz, I wonder, obviously you've been very diligent in doing your emergency preparedness, not just for this, but for many other things, but there have been significant cuts to the county public health department. I wonder if you could talk about, if this does sort of blow open, would that at all compromise your ability to respond?
I've made no cuts in the area of communicable disease, period. I feel, part of my message throughout the budget issue is that a department has to define what its core service is. What do the people in San Francisco expect from their Department of Public Health? And I would argue that the number one thing people expect from me is that I'm preventing communicable disease, whether that's HIV or sexually transmitted diseases or tuberculosis or, new strains of influenza. And that is the core function, that's the history, that's where public health departments grew out of. It's great that we can provide a range of comprehensive health and social well-being services. The core of public health, prevention of infectious diseases.
Coordination with other counties, exactly what is being done?
We just for the last couple years, actually, all the local health departments that circle the Bay have been meeting once a month to do pandemic flu planning. So we've all really been working together to make sure we're on the same page for quite a long time. What we've been doing over the last few days is that, as I mentioned, there's a CDC call every morning, there's a state call in the early afternoon, and then following that state call, the local health departments have had a follow-up conference call together just to make sure that we clarify any questions that came up on the state or the CDC calls. So that's what we've been doing for the last, 2 years, and specifically the last few days as well.
Every month for the last 2 years, the counties?
Yes.
Have been meeting.
And we have a unique relationship, as you know, with our airport, because it's in San Mateo County, with the San Mateo County Health Department. The good news there, for what it's worth, is the new director, Jean Fraser, may be very familiar to many of you here in San Francisco, as she worked here for
20 years.
Decades.
Yes.
Decades. So we're uniquely positioned to continue that outstanding regional partnership.
Mayor Newsom, with the European Commission advising against unnecessary travel to California, are you worried about tourism to San Francisco?
Yeah. I am, and that's why we want to calm things a bit. I mean, the old adage, seek first to understand, then to be understood, I think needs to be advanced here. People need to understand what we're dealing with first before we start asserting our expertise and creating a false sense of fear. I think you've already seen even President Obama start backing away a little bit from that organized press conference this weekend, just to calm things a bit. I think that's wise under the circumstance, and hopefully as the days progress, we'll know more, and people, I think, put this in perspective. My biggest fear, it's self-evident to all of you, the old adage, you're nothing but a mirror of your consistent thoughts. And you say, boy, I got a little headache. Oh, my gosh, I'm reading the news and the headlines, and wait, I've got that swine flu. And people running in hysteria, and I'm finished, the whole thing. So I just, everyone needs to calm those fears, and that's really one of the intentions of being here, and it's a way of answering the question as well. Again, but with the honesty that we don't know what to expect a week or two from now, and things could change, and that's why we're prepared, and that's another message. We are prepared if things change, and I don't want to say uniquely prepared, but I'll say it anyway. We are uniquely prepared because of that history that Dr. Katz referenced, because of that gateway status to Asia and Pacific, because of our international airport and the isolation strategies that we already have in place, because of our commitment to public health and the ability to test. You heard from Dr. Ferniak that we are testing what's happening from some of these EDs, emergency departments. They're sending over these samples to the county. That's something that not every county can do. We are uniquely positioned to do, so we'll know soon if indeed there are any cases, or sooner than most other counties. After they're alerted, we'll be the first alerting ourselves.
Yeah.
What was your
No, we haven't.
response plan when there is a case in San Francisco?
Yeah.
Shut down on schools.
Let Doug, yeah.
Right.
yeah.
So there will be a case in San Francisco, right? It just has to happen if the number of cases went from 20 to 40. There are 7 in California. Given our travel, we're going to have a case. And what's going to happen when we have a case is there's going to be a case, and we'll, honestly report it to you. But we're not nothing more in terms of a response will be triggered, because that case is likely to be a example of somebody with very mild illness who will get appropriate treatment at General Hospital. Now, because this is our training, when I worry, I don't worry, what am I going to do if there's a case? I have to think, well, what am I going to do if, a week from now there are 20 casualties, right? That's an issue, right? What if suddenly a virus that is not showing itself to be serious becomes serious? And the next step, and this is not unique to us, but we're prepared, is what people would call social isolation. That's how you prevent infectious epidemics, right? What you don't want is people congregated, because that's how they spread it. And so if let's say we had a cluster of cases, and the cluster of cases were around a school, you would close that school, but you wouldn't go further than that. But if you started to have some people getting very ill, that's when you would look to, okay, what does this mean? We have to tread very lightly, because anytime you're talking about social distancing, what you're really talking about is taking away people's rights to congregate. Right? And you don't take away, because we've already got, well, if there's any chance at all, shouldn't you already, be doing this? Like, no. As a matter of fact, you should not be taking away people's fundamental rights to congregate in the absence of any data at all that anybody is ill. So it's all about trying to balance our rights to come and go in a free society against, what is the danger. And right now, as the mayor has said, we don't have a danger, but we're watching it. And we're prepared. We have, for example, we write ahead of time all social isolation and quarantine orders, right? So if Dr. Ferniak has to quarantine someone, she doesn't then call the city attorney and say, oh, could you please put together a quarantine order? We have that already written. We have it already to the person, to the school. We have everything set so that if at any point it is necessary to pursue a more restrictive measure, we will. But the trigger would have to be, that this illness was seen in a lot more people and was causing serious illness, not mild respiratory infection.
What's the policy right now with flights coming in from Mexico?
So the people who come from Mexico are being examined by federal agents as they disembark. And people with symptoms are being referred to the San Mateo County Health Department, because they have jurisdiction because of the physical location of the airport in their county.
What are those exams like?
They're symptom reviews, but frankly, that's all you can do. I mean, there's nothing between symptom review and a positive nasal culture for swine flu. So it's not the symptoms of swine flu are almost identical. Well, they really are identical to the symptoms of any flu: fever, coughing, sore throat, malaise, tiredness. I mean, they are the same symptoms. So, but obviously, at this moment in time, you would have a different level of concern if someone came from Mexico. But the concern is not necessarily about their health, because at this moment, the swine flu in this country is not acting any more severely than the rest of the flu. Your concern, though, would be, you want to chart that case, you want that swab, you want the epidemiologic evidence. Frankly, in some ways, the more cases you have without serious consequences, the less worried you become, right? Because each documented case of swine flu where the person recovers convinces you that this flu is operating just like the human flu. We can't change it. And again, the concern is the virulence. The concern is that it becomes serious. So it's a symptom and visual examination.
Yeah,
Historically, how often does swine flu reappear? I remember from like back in the 80s or something, and how often does it actually pop up from time to time?
I don't know. I'll give you my best answer and see if Dr. Ferniak can improve on it, because my best answer is in general. What we know about influenza viruses, and they are viruses, remember, that's why they don't respond to antibiotics. You can't take any antibiotic that would be helpful, is that viruses very rapidly mutate. They very rapidly change. And so they change in humans, they change in pigs, and they change in birds and other animals that can get them. As the mayor explained, part of why we worry about episodes of swine flu is because pigs are genetically about halfway between humans and birds. And so a swine flu would be more likely to be infectious to humans and to support human-to-human transmission than would bird flu. And they do run in cycles. They pop up and then they burn themselves out. How recently, last cycle, do you know that?
Yeah, the last cycle was in 76. 1976 was when we had the last sort of, we had swine flu transmitted human to human in humans. Remember, I think that President Carter proposed a flu vaccination program for swine flu that was not that popular. So that was sort of our last memory in the United States. In addition, there have been sporadic cases of swine flu between pigs and people, primarily in people who work with swine. And those have been very limited, no human-to-human transmission from those. So there have been about 12 cases of that in the last several years.
Is there anything special you can do to prevent it other than what you would do with like the normal flu? And if not, what are your top 5 tips for people who are saying, should I ride the bus? Should I send my kids to school with hand sanitizer?
So I think what's really important for everyone to remember is that this swine flu that we're seeing in the U.S. is identical to what we generally see with seasonal influenza. It's very, very similar. And what the CDC's done that's very interesting in the cases that occurred earlier in the U.S., not obviously the New York ones that were just identified, but they actually went to all those people's close contacts and took blood samples to see who else had been infected. And what they're finding is that when someone's exposed, there's about a 25% chance that you're going to get infected and about a 13% chance that you're going to develop symptoms. And that's just what we see with seasonal influenza. So we're seeing a virus that acts just like our normal seasonal influenza. So again, it's just what we do for seasonal influenza. Stay home when you're sick, cover your cough, wash your hands, and please don't cough in other people's faces.
Why are some countries banning pork products? Is it just ignorance?
You know, I'm sorry, I'm not a like pig person, so I can't actually address what the risks are from maybe
right.
Dr.
There's no risk to eating cooked pork, period. Right, and so I think it is just misunderstanding. Right, I mean, you have to forgive people. It's not a unreasonable assumption to make that you would get swine flu from a swine. Right, so, but there is no basis and there is no danger at all to eating cooked pork, and of course there's always a danger to eating uncooked pork.
There are people going to buy masks at pharmacies. Is there a need to have a mask now?
There is not any need to have a mask at the current time. That's an excellent question. And I hear the mayor correctly answering the medical question. It depends. The kind that you buy, the CDC will not certify as being effective. However, all of us practically believe that they are effective as long as what you mean is they decrease the chance, right? They do not eliminate the chance. Because you're breathing, right? So the issue is whether or not the mask is fully preventing viral particles, which are very small, from getting through the mask. And even the effectiveness of a given mask probably varies over the course of the day, because as it naturally gets wet due to your saliva and other secretions and you're breathing on it, it probably becomes less and less. So, I mean, the reality is if we were in a situation, where there were a lot of people who were sick and where it was a serious disease, I would wear a mask. but I would not feel by wearing it that I was therefore safe and that no one could infect me. I'll come back to
Oh,
you.
sorry. I think Dr. Ferniak mentioned that you had some testing capabilities locally. It was my understanding that though there's only 2 sites that can currently test for this particular virus, they'll soon be bringing the Richmond lab online, I guess, later.
So yeah, let me sort of clarify. What happens is that in San Francisco we're very fortunate to have a PCR machine, and what that machine allows us to do is use genetic material from influenza A to actually test whether a sample is influenza A or not. Then once we can see that it's influenza A, we have the ability to look to see if it's the subtypes that are currently circulating, the human subtypes. What they've found out with all the cases of swine flu in the U.S. to date is that using PCR, when you try to subtype those influenza A's, they're untypable. And the reason that they're untypable is that our primers that we're using in our lab across the street are for human infection, and the swine flu is a swine infection. So at the CDC now, so all those untypable samples that were first detected in Southern California were sent to the CDC. That's where they were typed as swine subtypes, and that's where it was actually identified that there were swine flu cases.
I understand is going to be brought online to do this starting on Wednesday and Thursday. Will you be sending your samples there?
So what we're doing now, so for example, with the samples that we're getting today, we're going to test them first for influenza A. If they're positive, we're going to try to subtype them. If they're typable, then we're going to know they're human, and it's just seasonal influenza. If they're not typable, we're going to assume they're swine flu, and then we're going to send them to the Richland lab for confirmation.
And then my other final question, was just about undocumented workers. Is there anything specific you're doing to reach out to undocumented workers who might not visit a public health clinic even, or any other kind of provider?
Right, so again, remember this is a mild disease. We don't want people to seek health care who have mild symptoms or wouldn't otherwise get health care. So, in San Francisco, this is a very welcoming city for immigrants. We have many undocumented workers who get their care at San Francisco General and other COPC sites. They know they're welcome there, that they get good care. So our assumption is, as just like with everything else, if they're in a situation where they're ill enough to seek medical care, that they'll seek medical care. If they're not ill enough to seek medical care, there's no reason for them to seek medical care.
Can the doctor walk up and spell your name?
Carlisle.
And the first name?
Sue.
Okay. Thank you.
Yeah. Great, guys. Thank you all very much for coming up.